Hi, my name is Lee Matthews and I'm a physiotherapist, and this is Pilates Rehab Relax. Don't forget to click like and subscribe for all of our latest content. I'm going to guide you through a series of stretches. These are aimed at people with things like osteoarthritis of their hip, or we'd often call that wear and tear of your hip. Uh, so people have often present with sort of pain, stiffness around this sort of groin area. It can even radiate down the front of the thigh sometimes. It can be very variable how symptomatic people are. Sometimes you can have a really stiff hip that's not particularly painful. Sometimes it's more about pain than anything else, but work at a pace that's good for you. And I'd aim for these exercises to be done about twice a day, 2 repetitions of each, and hold in for about 10-20 seconds with each of them. You might do them after you've already had your pain relief. You might do them after you've had a warm bath or warm shower. And sometimes people even use things like a heat pack, a hot water bottle wrapped in a towel. Obviously be sensible with any heat you're applying. But you can just find that sometimes if it's warm before you do the stretching, that you get more benefit from those. So find yourself a nice secure chair. I'm going to use a dining room chair. You might have a nice chair. Sofa's a little bit too soft for this, and it can't be a chair with wheels because that just wouldn't be safe either. And bring yourself into seated position. I actually say to people sometimes that you could even try and do them discreetly when you're using the bathroom, because sat on the toilet, if there's adequate space, most people sit down on the loo at least once a day, so you could use that to make the most of a regular stretching routine. So I'm going to bring myself slightly forwards on the chair. I've got a gap behind me, so I've got some room for myself to move. So my bottom's relatively close to the edge there, but obviously be safe above all else. So the first of our stretches we're going to do is this movement of the thigh coming up towards the chest. So by flexing the hip, we can do that with either having our hand supporting underneath the thigh or on the front of the shin there. So if you've got a bad knee, then you want your hand to be under the thigh there, and you can hug that knee in. So this is a gentle knee hug. The other alternative would be to give some pressure on the front of that shin, and again you might find you can pull in a bit more firmly in that position. Hold it for a few seconds there, and then back down again. So these are stretches that's going to take our hip through all of its available movements, because sometimes that ball and socket joint can get quite stiff, and the muscles around it can also be quite stiff, and by doing these stretches it can reduce any stiffness that's there, and the implications being that then when you go to do things like roll over in the bed, get out in and out of the car, put things like shoes and socks on, it can be just a little bit easier there. I don't mind pops and creaks, I don't mind twinges with these, but what I would say is that if it's making you sore after you've done them for more than half an hour after the exercise, then you're pushing too hard and you just need to go gently there. We really are looking for that little and often approach. There we go, so 2 on each side of this one, and that's our gentle knee hugs over and done with. There we go. So the next movement we're going to do of our hip is one where the legs come out and apart from each other. This is a movement we call abduction. So if you took something away from something, you'd abduct it, and that's what we're doing with our hip. This movement is hip abduction. So in this position, my knees and my feet have walked apart from one another, and we can just hold that on its own, or you can add a gentle stretch there. So there we go, and you'll feel that all within the inner thigh there. And again, we hold for about 20 seconds and then back in again. Take that stretch off for a moment and then walk those feet back out again. And again, you might just be comfortable or find that's enough of a challenge just holding that position, but you could just add a gentle stretch on there, or even just helping to maintain the position really. And then relax again. So there's a couple of other movements our hip does that we can also stretch in this position. There's a couple of rotation movements. That ball and socket twists around on itself. So one of those moves, if we keep our knees together this time, so whereas before we walked our knees and feet apart, let's keep our knees together, but we're going to walk the feet apart. So in doing so, that hip joint is rotating inwards, they're both rotating inwards, and that's a movement we call internal rotation. So what I'm now going to do is add a gentle stretch on there as well, and I can definitely feel that in the hip joint, so you'll feel it around the top of the thigh when you do this. Very frequently, people will find that one side moves further than the other, and that's completely normal. Nobody is perfectly symmetrical, and if someone says that they are, they're just not looking closely enough. There we go. So we'll release that stretch again, and let's do the same movement again. So again, those feet remain apart, the knees drift in towards one another, and we're going to add a little bit of pressure on there. And then relax. So if that was a movement of internal rotation of that ball and socket joint, we need to stretch the hip in the opposite direction, that external rotation. So let's drift those feet in towards one another, let those knees fall out to the side. So it's a bit like a frog leg position now. And again, on its own, we'll add a gentle stretch there. And let's hold it. So my heels remain together there. My knees are just gently hanging apart, and again you'll feel that stretch on the inside of the hip here, and maybe on the inside of the thigh as well. And then relax again. And one last time. So it's kind of like a frog's leg position there. Those heels remain together. That's good. So there's one other stretch that we need to do. There's a muscle that goes along the front of our thigh and onto the back here, and that muscle can sometimes get quite tight, particularly if we spend a lot of our day in seated. And the other movement that we haven't sort of done is our leg comes out behind us. So we can actually stretch that muscle and that hip joint in the same one stretch. So what I'm going to do now, I'm going to twist sideways onto the chair. So if I move around sideways, so you need to be careful when you're doing this. So my bottom cheek, one of them is sat on the chair, the other one's hanging off the edge here. And what I'm going to do now is walk that foot back and behind me slightly. So I might even just turn sideways on slightly a bit better so you can see this. So I'm sat sideways on the chair. You might even have a table in front of you to hold on to. And what I'm going to do, hold in this position, keeping my back nice and straight, I'm going to bring my leg down and behind me. And at a certain point, you might find it's even here, you might find it's back there. You'll find a stretch on the front of the hip joint here, and you might even feel a stretch around this bit here, or down lower into the thigh there. But this is a stretch for the muscle on the front of the thigh, and actually into the hip a little bit there as well. So we're going to hold that for about 20 seconds. And then back up. So be safe above all else. But you can see why doing this, we suggested, we'd say not to have arms on the chair because you just couldn't do the stretch. So again, I'm going to start with my feet together, my bottom's hanging off of the chair on the side. And again, you could have a table in front of you or something to hold on to. But let's slide that leg along the floor and behind until you feel that stretch. And this is one of the safest ways I know of stretching the muscle on the front of the thigh there. But again, just if you need to hold onto a chair, if you need to have a table in front of you, then please, safety comes first here. And let's go back to the other side again. So bottom cheek hanging off the edge here. I'm going to hold onto the chair again for this one, and then again sliding that leg out and behind you, and hold that position. And then relax. And one last go. And that's it. So there you go, guys. Well, look, I hope you found them useful. I can't promise it's going to get you doing the splits or kicking like Jean-Claude Van Damme, but it might actually make it easier, things like getting in and out of the car, rolling over in the bed, and it can really be useful. They're aimed to be done little and often, so don't go forced into agony with them. Just work at a gentle pace, and you might find over time that it helps there. What I'd also suggest is, alongside that stretching, it'd be really useful if you're doing some gentle strengthening things, and there's some gentle Pilates exercises like bridging, where you lift your bottom off of the mat a small amount, strengthening the muscles on the front of the thigh. Strengthening and reconditioning the muscles around the hip can also be really valuable alongside this. So I'll put some links after this to doing these stretches in laying, and also some gentle strengthening exercises that might be useful there as well. So thanks for watching. Take care, guys.